Dr. Allen Atkins Weish, who served as the first president of the organization, founded the Charlotte Medical, Dental, and Pharmaceutical Society in 1900. The society was created to provide a professional association for African American healthcare specialists in Charlotte. At the turn of the century, physicians were moving to Charlotte to open private practices or to work at the Good Samaritan Hospital, which was the first hospital in the United States to exclusively serve African American patients. Many of the doctors in Charlotte at that time had received their training at schools that only admitted African Americans, such as Howard University Medical School in Washington, D.C., Meharry Medical College in Nashville, Tennessee, or the Leonard Medical School of Shaw University in Raleigh, North Carolina. During this era, the society served as a support network for these professionals and their spouses and was open to all minority physicians, dentists, pharmacists, and other healthcare providers. The society also provided the necessary forum for minority healthcare providers, which enabled them to stay abreast to the current advancements within the medical field. Our honorees and members alike were important figures in the community. They practiced medicine at the height of the civil rights movement. In Charlotte, segregation was alive and well and was evident in all areas of healthcare. An important example of challenges in healthcare for African Americans in Charlotte was the Good Samaritan Hospital.
The Good Samaritan Hospital was conceived in the mind of Mrs. John Wilkes, a nurse from the Episcopal Church who recognized the need for civilian hospitals for those who at the time were called freed men. Hospital construction was completed in 1891 with room enough for 20 patients. The Black community regarded this facility with awe and suspicion at first, and then the fear dissipated as support rose for this hospital. The institution's mission of charity was frequently hampered by its lack of funds, and it rendered the best services its means would allow. Good Samaritan Hospital was the only hospital servicing the African American community before 1955. However, it inadequately cared for their needs. Mercy Hospital subsequently opened 30 segregated hospital beds in 1955, while conditions at Good Samaritan Hospital continued to deteriorate. In 1960, the Episcopal Diocese sold the hospital to the City of Charlotte for $1, and Charlotte Memorial Hospital Authority took over its operations. The civil rights battle then continued to allow Black patients and physicians unrestricted access to other Charlotte area hospitals. In 1962, appeasement by allocation of these beds on a racial basis was not enough to quiet the Black healthcare professionals of Charlotte. The battle against segregation continued as instances of patient discrimination were cited. On August 23, 1963, the U.S. Public Health Services investigators found that Charlotte Memorial Hospital was discriminating against Black patients in violation of federal law. Following this assertion, the hospital announced a new open-door policy in which it declared, "It can be assumed that Memorial Hospital will begin immediately to apply the same admission policies to Negro patients as to white patients." And finally, the long struggle had come to an end where access to services were no longer separate and unequal. The changing social landscape during the early decades of the new century energized the Charlotte Medical, Dental, and Pharmaceutical Society. It propelled many of its members into the public eye as they sought for and demanded equality from the medical community in Charlotte.
Dr. Reginald A. Hawkins seared his name into local North Carolina history as the first African American to run for governor of the state in 1968, and is considered to be one of the patriarchs of the civil rights movement in Charlotte. Dr. Hawkins was a dentist and an ordained minister. He was born on November 11, 1923, in Beaufort, North Carolina. He earned his dental degree from Howard University in Washington, D.C. in 1948, a Bachelor of Divinity degree, and a Master's of Divinity from Johnson C. Smith University in Charlotte, North Carolina in 1956 and in 1973, respectively. He was a devoted member of Kappa Alpha Psi Fraternity Incorporated. During the mid-1960s, hospital discrimination was prevalent throughout the United States and in Charlotte. During the 1950s, Black physicians and dentists began to seek membership in the North Carolina Medical and Dental Society. However, their applications were denied. Dr. Reginald Hawkins recognized this overt inequity and on March 30, 1960, filed a federal lawsuit against the North Carolina Dental Society for discrimination of membership. The suit was initially dismissed in the early 1960s, but was eventually ruled in Dr. Hawkinson's favor in 1966. Subsequently, on April 13, 1966, Dr. Hawkins was granted membership to the North Carolina Dental Society. Dr. Hawkins continued to be a force in the community and was greatly involved in the civil rights movement. He was involved in school boycotts in the early 1960s in Charlotte, knew Dr. Martin Luther King Jr., and was an organizer of the March on Washington in 1968. Throughout his life, he continuously endeavored to make a difference in the community. However, despite all of his great achievements, his religion and family remained pinnacle to him. Dr. Charles James was born on November 22, 1923, in Glen Cove, Florida. He graduated from Johnson C. Smith University in 1948 in Charlotte, North Carolina. He received his medical degree from Meharry Medical College in Nashville, Tennessee in the 1950s. Dr. James, as a staff physician at Good Samaritan Hospital, began his practice in Charlotte during the tumultuous civil rights era, with the assistance of Dr. Roy S. Wynn in September 1958. Dr. James realized early in his career that the medical community at large was disregarding the working poor and blue-collar African Americans. Based on that revelation, he decided to concentrate his practice in the Second Ward of Charlotte, and he served this community diligently from 1960 to 1963. His first employee was Miss Mary Clark, who served as his nurse and bookkeeper. Miss Gurley Sanders joined his staff in 1960, and with these two, Dr. James built a reputation for clinical excellence and an advocate for the needs of his community. In 1963, Dr. James relocated his office to 3rd Street in Brevard, which is now Park Plaza, where he practiced for over 10 years. He and his staff, with the addition of Ms. Carrie Little, regularly serviced more than 800 patients. The practice of medicine was a labor of love for Dr. James and allowed him to always make community service a priority. And by the end of his career, his practice served well over 4,000 patients. He was one of the first African Americans appointed to the Charlotte Memorial Hospital teaching staff when it was integrated in 1963. He was able to fervently mentor young African American physicians, which prepared them to meet the challenges and needs of their community. Dr. James was involved in numerous professional, social, and civic organizations. The Old North State Medical Society continued to foster the growth of the minority medical community in North Carolina, in which Dr. James served as a vice president. His leadership also continued on the local level, in which he served as a past president of the Charlotte Medical, Dental, and Pharmaceutical Society. He is a life member of the National Association for the Advancement of Colored People and Kappa Alpha Psi Fraternity Incorporated. Out of all of his accomplishments, Dr. James is a devout Christian, a devoted husband, father, and a grandfather that enjoys indulging his grandchildren. Additionally, he served as an ordained elder at the C.N. Jenkins Memorial Presbyterian Church. He has been described as an avid learner that loves to travel and was rarely seen without his camera to document his travels. Dr. James also enjoys playing tennis and growing roses.
Almost a century after the Civil War, the descendants of slaves emancipated by President Lincoln's executive order and by the 13th Amendment to the U.S. Constitution still were not really free. Black children of the South did have the opportunity to get a basic education, and some went on to college, either to all black institutions in the South or to unsegregated schools elsewhere. When they emerged to find, as Dr. Emory Rand did, that their degrees, training, and talents were not sufficient enough to overcome the hindrances that they encountered because of the color of their skin, they resolved to remove these barriers by other means, a civil rights revolution. Dr. Rand was born in Keystone, West Virginia on March 9, 1914. He received his Bachelor of Science degree in 1934 from Johnson C. Smith University, a Master of Science degree from the University of Michigan in 1936, a Doctorate of Medicine degree from Meharry Medical College in Nashville, Tennessee in 1948, and an honorary degree from Johnson C. Smith in 1982. He set up a practice in Charlotte in 1949 at the urging of several already established black physicians in the city. Hospitals, medical societies, and most medical practices were segregated at that time. He, like many of his colleagues, did not meet the requirements to procure a position on the medical staff of any of Charlotte's general hospitals except the Good Samaritan Hospital, which solely served the African American patients. Dr. Rand and other Black physicians could belong to the Charlotte Medical, Dental, and Pharmaceutical Society, but membership in this organization did not provide access to hospitals, the American Medical Association, or other professional credentials. In 1951, Dr. Rand applied for membership into the Mecklenburg County Medical Society. His application was denied, marking the first formal effort to desegregate the medical community. In 1953, motivated by a common call to conscience, several young doctors agreed to desegregate the Mecklenburg County Medical Society by deleting the word white wherever it appeared in the constitutions and bylaws. This proposal moved forward in 1954 without the support of the North Carolina Medical Society, allowing Dr. Rand to become the first Black physician to be accepted for membership into the Mecklenburg County Medical Society. Dr. Rand was not satisfied with county membership alone and wanted to receive privileges on the state level. In the spring of 1960, he applied for full membership into the North Carolina Medical Society, and his application was rejected. 2 years later, the Executive Council of the State Medical Board met again with a conciliatory tone as white physicians' views were shifting in favor of full desegregation. Unfortunately, a few members of the society continued to resist. One advocate warned, "It will allow Negroes to come to our dinners and to dance on the floor with our women." With resolve, the Black and white physicians persisted, and in 1965, 14 years after Dr. Rand first applied for membership into the Mecklenburg County Medical Society, the North Carolina Medical Society fully desegregated. Dr. Rand served as chairman of the MATAP Conference for Hospital Integration from 1964 to 1969 and was the president of the National Medical Association from 1973 to 1974. From 1989 to 1991, he served as Regional Sire Archon of Sigma Pi Phi Boule. Further, he was a member of the Guardsmen and a life member of both the NAACP and Alpha Phi Alpha Fraternity Incorporated. He was an elder in Memorial United Presbyterian Church. Dr. Rand accomplished much in life. He penned the lyrics of the alma mater for Meharry Medical College. As an avid and passionate writer, Dr. Rand compiled and published 2 manuscripts of his poetry and recollections, Beat of the Tom-Toms and Potpourri. In all that he accomplished, most importantly, he was a man of God, a loving husband, father, and grandfather.